Welcome back to the Cornies Notes version, Health Matters Simplified, so you can understand. Pleased to meet you. I'm Dr. Matthew Cornies. Today, we're going over lower back getting started. So these are recommendations that we make when we're talking about your spinal hygiene. With our spinal hygiene, remember, we're always going to move it, then we're going to stretch it, then we're going to strengthen it. So let's get started. We start on our back. We start on our back with our feet and knees about shoulder distance apart. We're going to have our feet flat on the ground, and this should be a comfortable position. Then for motion, we're going to start with the pelvic curls. For the pelvic curls, you're going to arch your back a little bit, like you're trying to stick your butt out. You should be able to slide your hands just underneath of your lower back while you arch, and then relax. And then tuck, using your stomach muscles to curl your butt underneath, and then relax. So we're going to arch, relax, tuck, relax, arch, relax, tuck, relax. And we'll do about 10 to 15 repetitions of that, where one repetition is the arch and the tuck. And remember, this is for motion. We're just trying to loosen it up so you don't have to hold the end of either of these movements. Next, we do wag the tail. That's where we're arching just to one side and then letting it relax, and then arching to the other side and letting it relax. Looks kind of like a dog wagging their tail. Just trying to get things loosened up and moving. Then we'll do the pelvic rolls. For the pelvic rolls, you're going to extend or arch your back to one side and then roll it over to the other side and roll it back. And you're going to go back and forth with this, again, remembering that our goal is motion and we're not going to push hard into pain, but it's okay to bump up against the edge of discomfort. Now that we've got things loosened up with some pelvic curls, some wag the tail, and some pelvic rolls, now we're ready to stretch it. When we do the stretch, we're going to first do the knee to chest stretch. We'll do one knee at a time. Straighten one leg, grab the other knee, and pull it up towards your chest. Really, you want to pull it up towards your armpit. They should have called this one the knee to armpit stretch. Straightening that leg, letting that leg come off to the side. Oh, that feels good. And pull it up towards your armpit. Hold about 10 to 15 seconds. Remember, 10 seconds is more the recommendation if we're not really trying to lengthen the muscle. And as you can see, I'm quite flexible with this one, so I'm not holding it a full 15 seconds because I'm not trying to lengthen the muscle. When you're trying to lengthen the muscle, then you want to hold that full 15 seconds. Really, 5 times is going to be ideal. So we did the knee to chest stretch. Now we're going to do the twist, or the twist stretch, or the pelvic twist stretch, or the spinal twist stretch, or the full spine twisting stretch. There's a lot of names for this one. That's okay. But here's how it works. We break it down so you can isolate this lumbopelvic region first. So we're going to shift the hips to the side, straighten the leg that's now in the center, shift and twist so that your belly button is now pointing off into the direction while your spine starts to twist. Grab the bent knee with the opposite hand and then pull the knee down towards the ground, creating a twist or a stretch in the lumbar region as your pelvis rolls to the side. Back to the starting position, and we'll do the same thing the other way. We're going to shift, straighten, shift and twist. Let that foot rest. A big mistake people make is they want to push with this leg. We don't want to push here. We just let that foot rest on the downward leg, grab above the bent knee, and pull the knee down, creating the stretch here. To add the full spine, from this position, we can put this palm out 90 degrees at the armpit with the palm down, and then lift our head and turn and look towards the outstretched hand. Holding for 10 to 15 seconds, and then back the other way. We'll show it again. We're going to shift, straighten, shift and twist, and relax into the stretch. Oh, that feels good. You'll notice with this one, the higher you bring your knee up, the more you're going to feel that stretching here into the hip, into the glute. And the lower you leave your knee, the more you're going to be able to rotate, and the higher you'll feel it stretch up your back. And so for this exercise, really do it the way that it feels the best in that moment on that day. Some days your hip will be hurting more, and you'll want to bring that knee up higher and really get it into the hip. Other days, your lower back will be more of a concern. You'll leave the knee lower, you twist a little further. Oh, that's where it's getting it in the perfect spot for me right now. Remember, the down leg is relaxed, your shoulders should stay reasonably flat, your gaze should be at the ceiling, or adding that upper body. Palm down if you add the upper body to the twist stretch. Back to the center. And now we're going to get into the hip. This next one, if you look it up, it's called the piriformis stretch, because the piriformis, or really the group of external hip rotators, are what we're focusing on. And so for the hip stretch, or the piriformis stretch, we're going to cross one foot over the opposite knee, and then do a single knee to chest with this leg, bringing the crossed leg along for the ride. Now, often you'll see people and they're reaching under here and they're just pulling the whole thing up. I actually like to support my knee here and support my knee here as I bring it up and then hold. The stretch, of course, is happening here. Hold 10 to 15 seconds and do the same thing on the other side. Cross your leg over. Then it's like a single knee to chest. Notice I'm not doing a sit-up reaching towards my legs. If you try and reach towards your legs, then that's going to flexion load your lower back, and that'll tend to irritate it. So make sure that your upper body stays relaxed for this one, and bring your legs up to your chest as opposed to bringing your chest up to your legs. Again, I like to support my knees on this. And in this hand, I'm pushing gently in a downward position as I support the knee. In this hand, I'm pulling up towards the chest. And that's as far as I need to go today. And I'm really feeling that stretch in my right hip. So I'm going to do this one more time on each side. This is the hip stretch. Oh, it feels good. Sometimes when we come down, I'll stretch that hip a little more by pushing it down and bringing it back up. Just loosen it up. Remember, motion is lotion for the spine, and really for any joint in your body. Getting a little bit of motion in there is going to get the fluids exchanging through the joint, and that's going to help you feel better. It's going to help the joint to heal. It's going to help the joint to function more normally. And now we're to strength. So we did the motion, always motion first. Then we did the stretching. Now we're going to do strength. We're going to do stronger for longer, and this first one is called the bridge. The physical therapists call it the glute bridge, and we're just going to lift so that our knee, our hip, and our shoulder are in a straight line. When we're doing stronger for longer, we want to hold for 10 seconds, about 10 times, and then come back out of it. In between repetitions of my isometric strengthening, I like to do just a little bit of motion and then back up into it. I think I just mentioned a new word, so let's talk about isometric while I hold this bridge. Iso means the same. So the root for iso is the same. Metra means length. So an isometric strengthening exercise is one where we're strengthening, but we're not allowing any movement to happen. So there's no change in length of the muscle, but we're creating that muscle to have to engage and then hold. So right now it's my back muscles and my glute muscles and my legs that are holding in the bridge position. If we can hold for 10 seconds, 10 times, that's really going to build our endurance quite quickly. So we've strengthened the lower back here with some bridges for time. I'm not going to do all 10 repetitions, but for demonstration purposes, just want to do one more, and then we're going to flip over. When we're doing strength, we remember that we always want to build opposing muscle groups. So what's the muscle group that opposes the back? The stomach. That's exactly right. And so last, we're going to do the planks, and the planks are going to help us to build that stomach. So we flip back over, really the core. To do our plank, we can do them on our hands like this, or we can do them on our fists. If we do it on our fists, we do it like we're driving, not like we're punching somebody. So this is correct, this is not. So we get down with our fists in the quadruped position, fist under shoulder, knee under hip, and then we're just going to step back into the plank position. Now we want our shoulder, our hip, and our knee in a straight line. Our head should be in a balanced position as well. We want to hold this for 10 seconds, about 10 times. When we come out of it again, we want to do just a little bit of motion. This motion exercise is actually called the cat camel or the cat cow, and then we can go into our next rep. We're going to hold that for 10 seconds, and then we've done our strength. The twist stretch is my favorite, so after doing the planks, I usually go back into the twist stretch one more time and then finish up. Thank you so much. That was low back getting started. I did add a little bit of the upper body with the full spine twisting stretch and showing the cat camel, cat cow, but that's low back getting started, the Cornies notes version. Remember, get adjusted, because it feels good.